Good evening once again, sweet soul. Thank you for returning to continue your evaluation. Following our cranial nerve assessment, it is paramount that we examine your vital signs thoroughly. Vital signs are the fundamental indicators of your internal harmony. Your alignment between body, mind, and other facets. We begin with blood pressure. A measure of the mechanical force your circulating blood exerts against arterial walls. This force reflects both physical health and, in certain cases, subtle interaction between dimensions. Let me just get this around your arm. Thank you. Here we go. Cuff positioned 2 centimeters above the brachial artery. Manual sphygmomanometer engaged. Listening for quarter cough sounds. Phase 1. Phase 5. Yes. Systolic 144. Diastolic 92. Marginal hypertension detected. Uncommon given your resting presentation. Yes. Next, cardiac auscultation. Heart rate, rhythm, intensity, and any adventitious sounds. Yes. Normal S1 and S2 sounds. No murmurs, rubs, or gallops detected. However, a periodic compensatory pause every 12 cycles suggests occasional premature ventricular contractions. Benign, typically, though sometimes indicative of underlying latent energies. Now, respiration elevation, rate, rhythm, depth, and character. Breathe in for me. again. Good, again. All right, let me just go around your back here. Breathe normally. Good, again. Good, one more. Good. Now please take a deep breath. Exhale. Good, good. Respiratory rate 16 breaths per minute. Within normal range. Tidal volume elevated. Effortless despite increased intake. Draws more than oxygen. Draws possibility. Okay. Temperature assessment commencing. A non-contact infrared thermometer will measure surface heat emission. However, given recent anomalies, a core reading will be extracted via an under-the-tongue thermometer. Surface temperature, 96 degrees. Low, but expected among those in prolonged stasis or transition. Sweet soul, please place this under your tongue. Yes, just like that. Hold it. Good. Core temperature consistent. Unsettling, giving surface readings. And lastly, oxygen saturation. Conventional oximetry is insufficient for certain patients. Therefore, I will employ an instrument reserved for SleepVeil observations. The pulmonal resonator. A hollow metallic conduit, silver-threaded, narrow as a breath. This resonator bypasses superficial readings, entering the pulmonary depths to retrieve authentic saturation data. Sweet soul, just remain still. This will enter your chest slightly, entering your lung. Introducing the resonator into the thoracic entryway. Navigating past the pleural sheath. Reaching primary bronchi, approaching alveolar fields. Ah, yes, there it is. Obtaining blood gas analysis now. oxygen saturation, 94%. Borderline hypoxemia. Transient desaturation detected. Pulse oscillations irregular. Possible extrinsic interference. Let me just pull this out carefully. Yes. Okay, let me just write this down. Oh, sweet soul. I believe further investigation will be required. There are readings unattributable to any known physiologic cause. I must request a specialist consult before it reaches critical mass. For your safety and continued observation, a consultant with expertise in cognitive interference will be summoned shortly. Rest assured, we will discover together whether these shadows are mere echoes or something more substantial. Until we speak again, sweet soul.